Welcome to today's webinar titled Tricare Program Options for Maternity and Newborn Care Coverage. We are thrilled to have with us today Ms. Elan Green. Ms. Elan Green is Chief of the Medical Benefits and Reimbursement Division at the Defense Health Agency. The Medical Benefits and Reimbursement Division develops fiscally responsible and state-of-the-science healthcare policy for TRICARE through identifying, researching, and formulating medical benefit coverage and reimbursement systems. Without further delay, I will turn things over to Ms. Elan Green.
Hi, good morning. Thank you, Stan. First of all, I want to say thank you to everybody listening in today and participating in this webinar. It is truly a privilege and an honor to serve you. So moving forward, today we're going to be talking about TRICARE program options for maternity and newborn care. And as Stan mentioned, my name is Elan Green. So I'll move on to the second slide. I have to read this disclaimer for everybody. So the appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. I will move on to slide 3. This is our agenda. We'll talk about who is covered, what services are covered, what is not covered, who the providers can be for maternity care, how to get maternity care, your options for delivery, special considerations to think about when your child is born or adopted overseas, how to get coverage for your child. We'll talk about what's available for newborn and well baby care, and then give you some additional resources. And then finally, we'll have some questions and answers. So Stan mentioned that you can put those in through the portal. If I'm not able to answer them today, I believe, Stan, correct me if I'm wrong, I believe that we can take them back and we'll answer them later.
Yep.
So, okay, great. So I will move on to slide number 4, who is covered. So TRICARE covers expectant mothers who are active duty service members, retired service members, National Guard and Reserve members, or their eligible family members. You must be registered in the Defense Enrollment Eligibility Reporting System, or DEERS, and have a Uniform Services ID card. You must take action to enroll in a TRICARE Prime option or Tricare Select option within 90 days of eligibility, or you'll only be eligible for care at military hospitals and clinics. So that's very important. You need to enroll in one of those options within 90 days of obtaining eligibility. So continuing on who is covered on slide 5. For 2018, you may continue to enroll in or make changes at any time based on your eligibility. And for 2019 coverage, we're having some changes. This is also important to remember. You'll only be able to enroll in or change your enrollment during the fall 2018 open season or following a qualifying life event, or QLE. And some examples of those: getting married, having a baby or adopting a baby, or becoming Medicare eligible, or losing other health coverage. So those would be times outside of the fall open season enrollment period in which you could enroll or make changes to your health plan. So moving on to slide number 6, what services are covered? So TRICARE covers medically necessary maternity care. TRICARE provides a robust maternity care benefit, and it includes everything from the point at which you find out you're pregnant to postpartum and newborn care. So things that are covered include obstetric visits throughout your pregnancy, fetal ultrasounds when they're medically necessary, hospitalizations for labor, delivery, and postpartum care, as well as hospitalization that you may need during maternity, anesthesia for pain management, including things like epidurals for labor and delivery. TRICARE covers cesarean sections when medically necessary, Tricare also covers the management of high risk or complicated pregnancies and the services required for those. Um, Further, Tricare covers deliveries at Tricare authorized hospitals. We also cover deliveries at freestanding or hospital-based birthing centers. And then also, we will, under some circumstances, cover deliveries that are completed at home. And then following birth, Tricare covers breast pump supplies, and breastfeeding or lactation counseling services. So moving on to slide 7, talking about the services that are not covered. So medically, ultrasounds that are not medically necessary, sometimes you see those offering to reveal a baby's gender or give pictures. Those are not covered because they're not medically necessary. Services and supplies related to non-coital reproductive procedures are not covered under the regular Tricare program. For example, artificial insemination is a non-covered service. However, the pregnancy and birth following those sorts of procedures would be covered. Tricare does not cover the management of uterine contractions when it's done with drugs that are really not approved for that use. Tricare doesn't cover home uterine activity monitoring and related services. Sometimes those items are sold online for home heartbeat monitoring and things like that. That's not generally medically necessary and would therefore not be covered. Tricare doesn't cover private hospital rooms. Unproven procedures are also non-covered, and unproven means that it is not proven to be safe and effective for the treatment of a specific condition. And then Tricare also doesn't cover umbilical cord blood or umbilical cord collection and storage, except for those patients who undergo a covered umbilical cord blood transplant. And then moving on to slide 8, there's special considerations for overseas locations. So, for example, International SOS Government Services, or ISOS, which is the Tricare Overseas Program contractor, will not authorize medical care that doesn't meet internationally recognized and accepted standards. So if you're overseas, it is a good idea to check with and stay in close contact with ISOS regarding your maternity care. So I'll move on to slide number 9, and we'll start talking about who can provide maternity care. So Tricare only covers care that is provided by Tricare authorized providers. And that has a specific meaning. It's a specific list of providers that Tricare considers to be authorized to provide medical care. So this includes, but isn't limited to, an obstetrician or gynecologist, certified nurse midwives, family medicine physicians, general practitioners, or primary care managers. And you can visit this website. There's a hyperlink, tricare.mil/find-a-provider, and you can find a full list of Tricare authorized providers. So it's important to note that Tricare does not cover midwives unless they're nurse midwives. So that would include lay midwives, certified professional midwives, or certified midwives. Those midwives are not covered. And so again, to reiterate, certified nurse midwives are covered, but other types of midwives are not. Tricare also does not cover non-medical support during labor and childbirth, and that would be, for instance, a doula or a labor coach. So there's nothing, Tricare does not cover services provided by those individuals. So I'll move on to slide number 10, how to get care under Tricare Prime. So under Tricare Prime, you would go to your primary care manager, and you have priority access to care at military hospitals and clinics. Referrals are required, and prior authorization is required. For active duty service members and their family, there are no costs for care under Tricare Prime. And then there are minimal costs for retired service members and their families. And there's a hyperlink for more information and cost charts below. There's also another hyperlink, tricare.mil/costs, and it will give you a detailed breakout of what your out-of-pocket costs may be for maternity care. So I'll move on to slide number 11. This is how to get care if you're in Tricare Prime Remote or TPR. So if you have an assigned primary care manager or PCM, your PCM will direct your care. Otherwise, you may go to a network provider with prior authorization from your regional contractor. And then, as I mentioned earlier, active duty service members and their family do not have any costs for maternity care under Tricare Prime or Tricare Prime Remote. All others have copayments, and there's a hyperlink again where you can go and find those copayments. You can also go to tricare.mil/cost to find those. So I will move on to slide number 10. This is Tricare Select. It's the newest Tricare option offered in 2018. And so under Tricare Select, you may see any Tricare authorized provider for maternity care. So those are your obstetricians, certified nurse midwives, primary care provider, those folks. And so generally a network provider costs you less out of pocket, and the provider will file the claims for you. If you choose to see a non-network provider, as long as they're Tricare authorized, benefits will be extended. However, the care will cost you more out of pocket, and you may have to file your own claims. Referrals are not required for most services. However, prior authorization may be required for certain services, and the deductible must be met before cost shares apply. So I will move on to slide number 13. We'll talk a little bit about maternity care under the Tricare Overseas program. So the Tricare Overseas program, or TOP, for those enrolled in Prime, you would get care from your primary care manager or PCM at a military hospital or clinic. And if you're not located near a military hospital or clinic, or care is otherwise unavailable, your PCM will give you a referral to a Tricare authorized civilian provider in your overseas area. Under the Tricare Overseas program remote option, you would need to coordinate care with your top regional call center. And then there's a hyperlink below that directs you to more information about getting care overseas. On the next slide, slide 14, if you are top select, you may seek care from almost any Tricare authorized provider without a referral. And again, active duty service members and their family members with overseas Prime options, either Top Prime or Top Prime Remote, have no costs for maternity care. Top Prime and Top Prime Remote ABFMs may use the point of service option to self-refer to obstetricians. However, higher out-of-pocket costs would apply. And so moving on to slide 15, some of the other Tricare programs. We'll talk about Tricare Young Adult, Tricare Reserve Select, and Tricare Retired Reserve. So under Tricare Young Adult, or TYA, your maternity care is covered, but the newborn care would not be covered. You need to follow the rules of a plan that you have, either Tricare Young Adult Prime or Tricare Young Adult Select. And then there's a hyperlink here for more information about Tricare Young Adult and the costs associated with that program. Under Tricare Reserve Select and Tricare Retired Reserve, these are premium-based Tricare program options. Qualified sponsors may purchase coverage for themselves and or their family members, and the plans are similar to Tricare Select or Tricare Overseas Select. And there are some hyperlinks here for more information about those programs and their costs. So we'll move on to slide 16, delivery options. So where you deliver is dependent on your Tricare plan. Your costs may vary depending on where your delivery occurs, such as in a military hospital or clinic, a civilian hospital, a Tricare certified birthing center, hospital-based outpatient birthing room, professional office birthing suite, or in the home, which is important to note is not covered overseas. So as you can see, Tricare offers a wide variety for delivery options for whatever works best for you and your family. So on slide 17, we'll talk a little bit about what happens after your child is born. So overseas, I'm sorry. So we're talking specifically now for when your child is born or adopted overseas. So first, you would register your child in the Defense Enrollment Eligibility Reporting System, or DEERS. You would need to contact the nearest U.S. embassy or consulate to get a Social Security number for your child. Or, I'm sorry, you would need to contact your embassy or consulate and then get a Social Security number for your child. Family members are automatically enrolled in Tricare Overseas Program Select, and dependents of retirees must elect to enroll within 120 days of birth or adoption. So moving on to slide 18, we'll talk about getting coverage for your child, and this is not just overseas, but anywhere. So all biological and adopted children of active duty service members, National Guard and Reserve members, and retirees are eligible for Tricare. You need to register your child in DEERS right away. You must enroll in DEERS for Tricare coverage. You don't need a Social Security number to register your child in DEERS. Once you have one, update DEERS with that number. So it can take a few weeks to get a Social Security number. There's no need to wait until you get the Social Security card to register your child. You can register your child without that and then update DEERS later. Then you'll need to choose a Tricare program and enroll your child. And there's a hyperlink down here that on the slide that says that has more information about how to get care for your child and enrollment information. So I'll move on to slide 19. We're going to talk a little bit about coverage and enrollment. So as mentioned, all newborn and adopted children must be registered in DEERS, and it must be done within 90 days stateside or 120 days overseas. Stateside children of active duty service members, or ADSMs, are automatically enrolled in Tricare Prime if they're registered in DEERS and they live in a stateside Prime service area or PSA. If you don't live in a PSA, your child will be automatically enrolled in Tricare Select. Overseas children of active duty service members are automatically enrolled in Top Select if they're registered in DEERS. And retirees, both stateside and overseas, must take action to enroll their child in a Tricare plan. So I think that's important to highlight. Again, if you're a retiree and planning to have a baby or adopt a baby, you must take an action to ensure your child has coverage. Moving on to slide 20, we'll continue talking about Tricare Prime and Select coverage. Once children of active duty service members are registered in DEERS and are automatically enrolled in a Tricare plan, you can change your child's coverage to another Tricare plan within 90 days, and that's both stateside and overseas. So to restate that, once your child is registered in DEERS, if you want to make a change to their plan, you may do so within 90 days. Starting in 2019, after the allotted time period, which is 90 days, you must wait until another qualifying life event or open season to change your child's coverage. And you can learn more about qualifying life events at tricare.mil/life events. If your child isn't enrolled in DEERS by day 90 or by day 120, if they're overseas, they'll only be able to receive care at a military hospital or clinic on a space available basis. Your child will not show as Tricare eligible, and Tricare will not pay on any claims starting when the child is 91 days old stateside or 121 days old overseas. So I think to reiterate that, just please make sure that your child is enrolled in DEERS. So we'll move on to slide 21, Tricare Reserve Select and Tricare Retired Reserve coverage. So to ensure Tricare Reserve Select, or TRS, or Tricare Retired Reserve, or TRR coverage for your child, you must register your child in DEERS and enroll in TRS or TRR family coverage and submit the Reserve Component Health Coverage Request Form, which is DD Form 2896-1, to your regional contractor within 90 days or to your top regional call center within 120 days if you're overseas. You may be required to pay for care up front until your child is covered by TRS or TRR. If your child is covered within 90 days or 120 days if you're overseas, your claims will be paid retroactively. You must purchase TRS or TRR for your child to be covered. So if you are TRS or TRR, it's very important to take all of these actions within the established time frames, 90 days or 120 days, to make sure that your child has coverage. So I will move on to slide 22. We'll talk a little bit about what's covered under Tricare's newborn and well baby care benefit. So Tricare covers newborn, well baby, and well child care for Tricare beneficiaries from birth until age 6. And covered services include circumcision, routine newborn care, health promotion and disease prevention exams, vision and hearing screenings, height, weight, and head circumference measurements, routine vaccines, and developmental and behavioral assessment. In addition to this preventive care, Tricare also would, of course, cover any sort of medically necessary care for those children. So I will move on to slide 23, and this is a listing of Tricare resources as well as contact information for your managed care support contractors. Just to highlight that the contractors changed in January, so there are new contractors in the regions. There's only 2 now. Humana Military in the east, and Health Net Federal Services in the west. On the left side of this slide are hyperlinks to various publications and brochures with more information on maternity care. On slide 24, we have more contact information for your overseas regional contractors and call centers. And so these are the folks that will help you out if you are located overseas. And so that concludes the presentation. I'm happy to take questions at this time. So I think you can submit them through the portal to Stan.
Yep, questions have started to come in. Let's see here. The first question we will start with. Okay, it says, I have a couple of questions. I know that one vision exam is covered a year. Being that vision can change during pregnancy, are we allowed another exam when expecting? I'll just go through and just read the 2 questions since there's only 2. That was the first question. I'm currently enrolled in Prime, but will be temporarily moving to Maui for a few months where there are no Prime options. How would coverage work then for doctor's visits, ER visits, etc.? If switched over to Select for myself and my kids, would I be able to switch back over to Prime once we are back at a location that has Prime options?
Okay, so I'll answer the question on vision, and then I'll defer eligibility enrollment questions to customer service. So on vision, yes, as you mentioned, there is 1 exam covered per year. There are no changes made for pregnancy. However, if you have an injury or some sort of disease, that would be covered as medically necessary care. And so I'll turn over the other question to customer service because I believe it's an important question.
Hello, this is Francine Forrestal, and I work in customer service. And for that moving between a Prime location and a Select and back to Prime, in order for you to get coverage as a qualifying life event, to be able to change your enrollment, each time you move, you're going to first need to update your address in Deers to the new location. And as soon as you do that, you can call the regional contractor. Let's say if you're stateside now and you're going overseas, after you update your address in Deers, you then have 90 days to notify the overseas contractor that you are in that location and that you are Select. You might not live in a Prime service area or don't qualify for Tricare Prime Remote overseas. Then when you come back stateside, let's say, and you want to be Prime again, you have to do the same thing. Make sure you update your address in Deers to show that you are in a Prime location. And within the 90 days of putting your address in Deers, you need to call that regional contractor and let them know then now you want to enroll in Prime again. There is no guarantee that you would get if you're like, let's say if you move back to that same location that you were prime before. There is no guarantee, however, that you would get the same primary care manager that you had before you left. So update address in Deers, because that starts the 90-day clock ticking. And then within 90 days, you can go ahead and transfer that. If you are a retiree, you would need to make sure that you make the payments back to the date of that move, the date that you put your family in Deers to show that you moved. And that's all. Thank you.
Okay, thank you. The next question reads, will Tricare cover IUD placement after delivery or immediately postpartum when a beneficiary delivers in a military or civilian hospital?
So yes, Tricare covers IUD as well as a broad range of other family planning services. There aren't any limitations right now on Tricare policy about when that can happen. So as long as it's medically appropriate to do, Tricare would cover those sorts of family planning services. Yes.
Okay. The next question reads, patients are calling into Tricare and they are being told that if they have Tricare Select, they won't pay anything for their maternity care, and that their service shouldn't be applied to their deductible or cost share. But per this webinar, that is incorrect.
So cost sharing, of course, depends on your beneficiary category as well as the plan that you're in. So active duty, for example, active service members who are prime pay nothing for their covered services. However, if you're under Tricare Select, you would have, depending on your category, you would have, of course, enrollment fees and annual deductibles, as well as cost shares. And I'm looking at my cost share right now. So for instance, if you have an inpatient delivery, all of your maternity care is included in your inpatient delivery cost share. And say you're a Group B Tricare Select retiree, it would be $175 for all of that maternity care. So, and I don't know, Ms. Forrestel, do you have any other information on that? But I would say, you know, the cost shares really truly depend on your beneficiary plan or your beneficiary category and your health plan.
Correct. The plan and the category of the individual makes a difference as to any types of cost share. I agree wholeheartedly.
Mm-hmm.
Okay.
I hope that answers that question.
All right, thank you. The next question reads, where can I find the guidance that states home childbirth is not covered overseas?
Oh, I'm sorry, I have to come off mute. So overseas home births are not covered because the physician oversight of the midwife's care can't be established. And I'm looking for that. Let's see. I'm looking for the policy reference now. So midwives overseas need to meet the requirements listed in the Tricare Policy Manual, which is in Chapter 11, Section 3.12. And then that section also specifically excludes lay midwife who is neither a certified nurse midwife nor a registered nurse. And then if that doesn't answer that question, we can follow up later.
Okay, thank you. The next question reads, what is the referral process for a home birth? What will Tricare cover? Are there different rules for active duty?
So I checked with our services on this one. So the referral process shouldn't be any different compared to other healthcare services for active duty service members. And then for everybody, home delivery, when performed by a Tricare network or non-network provider, including a certified nurse midwife, would be covered. So on home deliveries, you know, you still have to have a Tricare authorized provider. So it couldn't be a lay midwife, but a certified nurse midwife may perform a home delivery. The referral process would follow the normal referral processes depending on your Tricare plan. And then in terms of what Tricare covers, it would be the same services that were outlined. You know, your regular routine prenatal visits, and then the delivery itself. So I hope that answers that question.
Stan, this is Calvin Keller, also with customer service. And Elon, let me add to that. When it comes to home births for active duty and for active duty family members, especially if you are trying to have a home birth on a military installation, regardless of whether you have a referral from your primary care manager, it is at the discretion of the base commander whether they will authorize you to have a home birth on base. So please also keep that in mind, that just because you have a referral does not mean that the base will authorize you to do home birth. Thank you.
Thank you, Calvin. The next question reads, slide 22 is a bit misleading. I read that coverage for children changes the day they turn age 6 to clinical preventative care. Let me go to slide. So I have slide 22 on the screen if you wanted to answer that question, Ms. Green.
So yes, so newborn and well baby or well child care are those services that are provided from beneficiaries from birth until age 6, and they're listed below. And then after age 6, Tricare continues to cover preventive care services, although it's under a separate policy provision, and those would include you know, things like health promotion and disease prevention examinations, well woman examinations, and then other clinical preventive services. So it's correct that, you know, Tricare at age 6, Tricare begins covering a different set of services, and then these well baby and well child services are only available for children under age or until age 6.
Okay, thank you. The next question reads, do you cover childbirth classes or breastfeeding classes?
So Tricare does not cover educational services. They're not medically necessary. So that would include childbirth classes or breastfeeding or lactation classes. However, lactation counseling, breastfeeding counseling provided by a Tricare authorized provider is covered. And then any sort of guidance that's given during prenatal visits would be included with Tricare, what Tricare would pay for the overall maternity episode. But no, we don't cover separate standalone classes.
Okay, the next question reads, do we call the Tricare regional contractor regarding a referral for an in-network provider or just talk to our provider?
So Francine, I may defer to you on this one. In general, it's a good idea to touch base with your managed care support contractor, but I'm not sure if there are any special rules that this individual should be aware of.
No, typically, if you're prime and enrolled to a primary care manager, you really should be seeking those services from that. PCM should write the referral for you to go ahead and be treated outside. Now, be aware that MTF don't have to release you if they have pregnancy care services available within that military treatment facility. So be aware of that. And as was pointed out in the slide, if you are Tricare Prime remote, as long as you are using a Tricare authorized provider to deliver your services, that would be great. But oftentimes in Tricare Prime remote locations, you are assigned a primary care provider that again should probably put in that referral. Once you are established with a Tricare authorized network provider, then they can, if there's any additional services that you need related to that pregnancy, they can go ahead and do that as long as it is a covered service and it is a network provider. You don't have to go back to your PCM. But if you choose to use a non-network network provider, then at that point, it's always advisable to go back to your primary care manager just for oversight of what that non-network provider is offering, because they aren't always aware of what all the Tricare Prime rules are. And like, let's say if they wanted to do an ultrasound because you want to know the sex of your baby, they may do that, but Tricare wouldn't pay for that. And that provider wouldn't be held accountable for that. The beneficiary would be held accountable for the cost for that. So always try to get to a network provider whenever possible. If you have an assigned PCM, get a referral for pregnancy care from your PCM. That's all.
Okay, thank you. The next question reads, which drugs are not approved for uterine contractions? They reference slide 7.
Sure. If you'll give me one moment, I can pull that up.
And I'm also putting the screen to slide 7 so that all can see.
And I'm sorry, I'm not finding the specific drug right now in the policy manual. However, I'd be happy to follow up later.
Okay, thank you. The next question reads, so what cost should we charge Tricare Select Global OB patients on their first visit? We don't have to charge them for copay for each of their OB visits.
So that's correct. There aren't separate co-payments or cost shares for each distinct OB visit. And instead, cost is dependent on the planned site of delivery. So for most folks, that's the hospital. And so the overall cost share would be based on the Tricare cost share for inpatient hospitalizations, and that amount depends on the beneficiary category and the health plan. And then for birthing centers, freestanding birthing centers, the cost share, again, there's not distinct cost shares for each visit. Instead, it's based on the ambulatory surgery center cost share, which again depends on the beneficiary category and plan. And then finally, for home deliveries, same thing. There's only one cost share applied, and it's based on the outpatient visit cost shares. And so you can find more information, detailed breakouts of all of these cost shares at tricare.mil/costs. But to reiterate, there's not separate cost shares for every single visit that happens in a maternity episode. And instead, it's based on the anticipated or planned delivery site.
Okay, thank you. Next question reads, for breast pump and supplies, what kind of coverage is needed? And also, what kind of prescription should I have? Also, how much of breast pump supplies is covered and for how long?
Sure. So Tricare covers a breast pump and associated supplies following a what's called a birth event, and that could include either adoption or a childbirth event. And I am pulling up more details on the breast pumps right now. So in general, Tricare covers one standard breast pump or let's see, I apologize, I'm looking down. One manual or one standard electric breast pump may be covered per birth event. And then Tricare also covers the supplies that are necessary to operate the breast pump, like a power adapter, tubing, adapters, bottle caps, and storage bags and other items when they're necessary for up to 36 months post the birth event. And Tricare, in order to be covered, a prescription is required from a Tricare authorized physician, physician assistant, nurse practitioner, or nurse midwife. And the prescription must indicate the type of breast pump prescribed, either a manual or standard electric. And then if you need a hospital grade breast pump, and these are different than the standard ones that you might purchase or see at Target. So these are specialized heavy-duty hospital-grade breast pumps. They can be used by multiple people with specialized kits. Those are covered by Tricare for mothers of premature infants. And so they're covered when the premature infant, for instance, is in the NICU, and then they may be covered after the infant is discharged when a physician documents the medical reason. There's a medical reason for continued use of the heavy-duty hospital-grade breast pump. So hopefully that answers that question. Tricare, as I mentioned, also covers breastfeeding and lactation counseling when provided by a Tricare authorized provider. And then Tricare covers necessary replacement supplies and things like milk bags.
Okay. Next question. At what point can we submit for reimbursement for a breast pump? Can it be before the birth, or does it have to be after the birth?
I'm sorry, I had to come off mute. So yes, it's good to note that you may currently go out and purchase a breast pump and submit a claim for reimbursement. And I am looking through the policy on when the birth event begins. Let's see, and there's currently not a limitation on when that needs to be done. However, you would need to comply with the rules for submitting an appropriately and properly completed claim form with a copy of the prescription and an itemized receipt. And hopefully that answers that question. Are there, Francine, do you have anything else on the breast pump?
No, I think you pretty much covered it. Again, it isn't limited to after you have the baby, but when your provider fills out the prescription, ask that they put the diagnostic code that you are pregnant. We recommend that you may use a network DME provider, again, because they'll understand the rules a little bit better, but you aren't limited by that. And as she indicated, if you're going to file your own claim, send in a copy of the prescription and a copy of the receipt. You can pick these up in your AFIS, your centers on your installation. You can go online and purchase them, but you're going to make sure you keep a copy at home as well, keep the original, and submit copies then for reimbursement.
Exactly. Thank you.
Okay. Next question reads, so Tricare covers maternity at 100%, but Tricare Select is maternity covered at 80%.
So I assume this question is about costs. And so it depends on, again, your beneficiary category. So for instance, pregnant active duty service members or a pregnant active duty family member would pay nothing for covered services. However, if you are a prime retiree, you may have cost shares. Similarly, for Tricare Select, cost share depends on if you're Group A or Group B, or if you're active duty or retiree. And it also depends for both options if you see an in-network or out-of-network provider. So, it's not that if you're Select that you're going to pay 20%. That would only apply in very specific situations, perhaps where you go out of network. So again, I encourage folks to go and look at tricare.mil/costs, and you can see a detailed breakout by health plan and beneficiary category to identify the cost shares that may apply in your specific situation.
And this is Francine. If you do go into tricare.mil/costs, and then you put down whether you're an active duty family member or retiree, there is a chart there, and they do have now maternity care listed. And so, for instance, right now, maternity office care for a Group A at the MTF is $18.60 per day because you are getting subsistence. You're getting your meals and your laundry done. Network, it's $18.60 per day, and non-network, $18.60 per day. Group B, network is $60 and non-network is 20%. So strictly to say that Select is 80-20 is not necessarily the case. If a Group B beneficiary, who means the sponsor came on active service after 1 January, it would be a $60 cost. So look under those tables in order to figure out where you fit and then what your costs would actually be.
Okay, thank you. The next question reads, I'm with a provider's office. Do we need to notify Tricare when a patient comes in pregnant and obtain an authorization?
So in general, the first pregnancy visit, and Francine, please correct me if I have this wrong, the first pregnancy visit is usually submitted on a claim by a provider's office. And then I think notification, referrals, and that kind of thing are really determined by the beneficiary's health plan. And so if, for instance, if you have a Tricare Prime individual who is seeing you as an out-of-network provider, the rules are different than if they're a Tricare Select beneficiary. Francine, maybe you can weigh in on that and provide a little more detail.
Mm-hmm. You know, it's the type of plan and what your beneficiary category is, but as she indicates, oftentimes that first visit is really for the purpose of establishing your pregnancy. And then if you're a network provider and you do determine that this beneficiary is pregnant and you're going to continue care, our suggestion would be at that particular time, if they show up as a Tricare Prime enrollee, then you advise that beneficiary to, if you're network, then you could submit a referral to go ahead and see that individual. However, I mean, that's the way it works now. It used to be you always had to send them back to their primary care manager. But now if you are a network select provider and you've determined they're pregnant and you're going to continue to serve them during their pregnancy, then what you need to do is just go ahead and submit a referral to your regional contractor for them to approve or deny that referral. Now, in some locations, it may be that if that MTF has the capability and capacity, they may pull that beneficiary back into the military treatment facility for the purpose of those providers of being able to maintain their licensure and continue to get the experience that they need for that as well. So be aware that that may happen as a provider.
And also, let me add, this is Calvin, and please keep in mind now with the new changes that are going to be taking effect, especially with the open season enrollment, is that if you're Prime and you say, well, I want to disenroll from Prime and do Select during my pregnancy, you will be locked out of Prime until you're only eligible for direct care after you disenroll until either the next open season or that qualifying life event, meaning your child is born. So please know that and please take heed to that.
And the other thing I would advise, if there's any other providers on the call, since enrollment will be required for Tricare services in the future, somebody may be eligible, but that does not necessarily mean they're enrolled. So if you have any questions, make sure you go online, confirm that they are actually enrolled in Prime or Select, or if they show as direct care only, meaning they can only get care at military, hospitals or clinics, you're going to have to tell them at that point that you can no longer see them. That's all I have.
Okay, thank you. Next question. Will Tricare consider a newborn as Prime for those first 90 days as long as one family member is Prime and resides in a PSA?
So this is Elon. I'm scrolling back up to find the answer.
This is Francine. I can jump in, Elon. Yes.
Oh, thank you. Okay.
Yeah, as long as one other family member is enrolled in Prime, they will go ahead and treat that. First 90 days stateside, 120 days overseas. They will process claims as long as that claim got submitted under the proper sponsor's SSN. But that 90 and 120 days is strictly for claims processing. You still need to take action to enroll in Prime or Select. A lot of people that senses, well, these claims are paying, and they are, so you don't think you have a problem. But day 91, day 121, when the claims coverage ends, then you're going to have problems. So as soon as you have that baby, make sure you're trying to get them enrolled in DEERS as soon as possible. Registered in DEERS, and as soon as they're in DEERS, call the regional contractor to get them enrolled.
Perfect. And then I think the steps are outlined in slides 18, 19, and 20 on the specific steps that need to take place.
Okay, thank you. Next question: are belly support bands or tops being covered to help relieve some back discomfort that can occur with pregnancy? Postpartum tops or bands being covered post-baby?
So items that are prescribed and that are considered durable medical equipment may be covered. They would need to be medically necessary and then generally provided by a Tricare authorized provider. And so sometimes there are braces and things like that that maybe, if they are considered durable medical equipment and prescribed by a Tricare authorized provider, may be covered. You know, I can't emphasize the medically necessary part enough. It's not that these things would automatically be covered or you would be reimbursed for them potentially if you were to buy them off the shelf. It needs to be something that is prescribed by a medical provider and that it also meets Tricare's definition of durable medical equipment.
Okay, let's see here. Next question reads: how are hospital days counted? Is it overnight or a 24-hour period? If you're at a cutoff point and stay an additional night, is it covered?
So Tricare would cover a stay as long as it was medically necessary. So if there were complications, you know, that for which additional stay would be required, that would be covered. So the mother and child hospital length of stay is not less than 48 hours following a normal vaginal delivery and 96 hours following a cesarean section. The physician may choose to discharge earlier in consultation with the mother, but there aren't any restrictions less than that. And then for inpatient stays longer than that, they would be covered so long as they were medically necessary for both mother and baby. In terms of how the period or the time is established, I believe it's a midnight rule, but I would need to check and follow up on
that. Okay. Next question: is there a link that we can view to see the different benefit plans and what their cost shares would be for maternity coverage?
So I think, this is Aylon, I think tricare.mil/cost is a great website. And then Francine, I'm sure there's one in the resources section, but is there a quick hyperlink for the overview of each plan?
Not at this particular point in time, again, because the beneficiary category, whether they're Group A, Group B, active duty versus retiree, starting with the cost page is really the best, and then identify what type of beneficiary category you are in. At this point, there isn't a separate maternity cost table.
Okay, next question. Sorry about that.
I was going to say, I found the answer to that question about the drug. It's subcutaneous terbutaline. It's a subcutaneous terbutaline pump and home use of maintenance subcutaneous terbutaline to suppress labor. So that's the item that was non-covered.
Okay. Next question reads: can ADSMS deliver at home in the U.S. or use a birthing center?
So both active duty service members and active duty family members may utilize birthing centers. as long as they met the Tricare, there's a list of requirements that need to be met in order for a birthing center to be considered Tricare authorized. But yes, those options are available, provided within your health plan you follow the appropriate rules for the health plan, whether it be using in-network providers, referrals, and that sort of thing. Francine, anything else to add on that one?
No, she is right in the fact that oftentimes they have to be participating providers and they have to have an agreement with a hospital so that if something would occur, that they have ready access to those types of services. So yes, you can't just go out and do it. You really do need to make sure that you are using the appropriate type of Tricare provider for those types of birth.
Okay, the next question. How do we find our PCM?
So I believe that these are assigned to you, but I'll defer to Francine on that since I think it's a referral question.
Right. Basically, to find your PCM, there's a couple of different ways of doing for your own convenience. If you get a DS Logon account, you can go into the MillConnect website. I'm not sure if that's one of the resource websites or not, but you can always look online there. You can go in through the Beneficiary web enrollment tool, and you can also just call the regional contractor. Those are the three ways that you can confirm who your PCM is. And if you are enrolled to an MTF, Mr. Keller pointed out, if you use the Tricare Online to make like your appointments at that particular point in time, that would also identify who your primary care manager is as well. That's all I have.
Okay, and since we are on the top of the hour, I'm going to just read one more question. And the question reads, what kind of document do you need to provide proof that the breast pump supplies are medically necessary if I'm breastfeeding for a year?
So the contractors can establish their rules about what's required for replacement supplies. There isn't a specific mention in the breast pump policy about what specifically is required, but in general, you would need to have a prescription specifying it, at a minimum the type of pump that's needed. So either that standard or electric pump. And then beyond that, your contractor may have some additional requirements or documentation requests. And so I suggest that you would touch base with them when you file your claim.
Okay, that concludes our question and answer session. So I would like to thank Ms. Green for sharing her valuable experience and expertise, along with the customer service group, Francine and Calvin. I would also like to thank our attendees for participating in today's webinar. And if you find yourself having questions after the webinar is over, or if we were unable to answer your question today, please contact your regional contractor. Also, many of the answers to questions related to Tricare benefit can be found on the Tricare website at www.tricare.mil. This concludes today's webinar on Tricare program options for maternity and newborn care coverage. Thank you all for attending and have a great day.